Hi everyone, my name's Nicole and I'm an athletic trainer at Columbia College. Today I want to talk about something really important that can happen after a serious or upsetting event in sports, like a severe injury, medical emergency, or other traumatic situation. We'll discuss what critical incident stress is and what a debriefing means and how talking through an event in a safe, structured way can help you process what happened and take care of your mental health. After a traumatic event, it's normal to have a strong reaction, physically and emotionally. A critical incident stress debriefing is a structured group intervention led by trained professionals that helps people understand common stress reactions, share experiences if they feel comfortable, learn healthy coping strategies, feel less alone after a difficult event. The goal is support and education, not therapy or forcing anyone to talk. This type of support can be helpful for athletes who witnessed a serious injury or emergency, teammates involved in a frightening event, staff or responders present during a crisis, or anyone who feels shaken, stressed, or overwhelmed afterwards. A debriefing is not required, and you should never feel pressured to share more than you want to. And it's also not a substitute for individual mental health care. If someone is experiencing ongoing nightmares, panic attacks, thoughts of self-harm, trouble functioning at school, sport, or home, they should speak with a licensed mental health professional as soon as possible. Here's what usually happens during a critical incident stress debriefing. Step one would typically include an introduction. So, a trained facilitator explains the purpose of the meeting. They set the ground rules like the confidentiality and respect aspects of it and reminds everyone that sharing is optional. Step two is known as the facts portion. Participants briefly describe what they experienced or saw. Just the facts, not detailed emotions yet. Step three is thoughts. People may share their first thoughts during or right after the event. Step four is reactions, and this is where participants can talk about emotional reactions if they feel comfortable, whether that includes fear, sadness, anger, or even numbness. Step five is symptoms, and here the facilitator explains common stress responses such as trouble sleeping, headaches, upset stomachs, difficulty concentrating, or irritability. And hearing that these reactions are normal can be very reassuring to the people in the group. Step six is coping strategies, and this is where the group learns healthy ways to cope, which we're going to further discuss in a moment. Step seven, the final step, is resource and closing. So the facilitator in this event provides information on who to contact for more help and encourages those to seek ongoing support. Even outside of formal debriefing, there are things that you can do to take care of yourself. The first and foremost, most important thing is to normalize your reactions. Strong emotions, trouble sleeping, or replaying the event in your mind can be normal in short term. You got to make sure that you talk to someone you trust, whether it's a teammate, friend, coach, another athletic trainer, or your athletic trainer, or a family member. Use simple calming skills, things known as box breathing, where you breathe in for four, hold for four, let out for four, hold for four, so on and so forth. Getting gentle movements in, like walking or yoga, stretching, or doing light exercise when cleared physically if you need to be cleared physically. And then just making sure that you're supporting your basic needs, trying to keep a regular sleep schedule, staying hydrated and eating regularly, limiting alcohol or substance use, which can worsen your stress symptoms. Taking a break from social media, constantly replaying videos or conversations about the event can increase stress. Um, it's also important to note that everyone responds differently to stressful events. Some people want to talk about it right away. Others might need more time before they're ready to discuss it. And some people prefer one-on-one conversations instead of conversing in a group, reliving all of that in front of a lot of people. And all of these are okay. Support should match what you're comfortable with. Stress often improves within few days to a few weeks. However, you should reach out to a healthcare provider or mental health professional if symptoms last more than a few weeks, progressively get worse, interfere with your activities of daily living, whether it's school, sport, or your relationships, and if they include thoughts of harming yourself. So, to summarize, after a traumatic event in sports, stress reactions are common and you're not alone. Critical incident stress debriefings are structured, supportive conversations that help people understand and cope with what's happened. Taking care of your mental health is just as important as taking care of your body. If you ever have concerns, talk to an athletic trainer or a qualified healthcare professional. I hope this helped. Thank you.